Hello, everybody. This is Dr. Madiha Saeed, a board-certified integrative holistic family physician, coming to you live from our home. Obviously, one of my children turned 6 years old today, so we are in the midst of the fun. So today, if you guys have not heard of me, my name is Dr. Madiha Saeed. I am AKA Holistic Mom MD, and I am here to educate and empower you guys from the inside out. How? By simple lifestyle choices that, if you incorporate into your daily routine, can actually heal and prevent chronic diseases in you and your family. So that's pretty exciting stuff. Today we're going to talk about, we've been talking about how your chronic symptoms, no matter what you're dealing with, if you're dealing with digestive issues, problems with autoimmunity, headaches, visual changes, problems with diarrhea, constipation, pain, cancers, allergies, asthma. So no matter what you're dealing with, ADD, bipolar, autism, chronic ear infections, constantly getting sick all the time. So no matter what you're dealing with, your underlying root cause is inflammation. And if we have an underlying root cause of inflammation, then it makes sense that we need to lower the inflammation in order to heal and prevent chronic disease. Because right now what conventional medicine is doing is, which is great for acute care, but when it comes to chronic care, it sort of misses the boat. And that is specifically because of the fact that, we're looking at all of the symptoms here, and each symptom gets a different kind of mode of treatment. But if we look at the underlying root cause of inflammation, you can heal not one symptom, but then all of them simultaneously. And that is what is so awesome. So let's go ahead and talk about, those factors of inflammation. Do you remember them, Abdullah?
Yeah.
Okay. So Abdullah's going to go ahead and tell us those factors of inflammation.
Well, there's deficiency. You have to have detoxify, there's mental health, there's social health, there's gratitude, there's healthy gut, eat the right food, and
Detoxify, sleep.
Yeah, and sleep.
Right? So to recap, that was digestive health and detoxification, right? And you want to make sure you're optimizing your food and your lifestyles. And I go through that in a lot more detail before. But that really is focusing on tons of vegetables, protein, healthy fats, bone broth, all those things that will help the gut heal. And then also, because it will help the gut heal and it will lower insulin levels and balance out your hormones when you optimize your glucose activity, make sure that everything is working properly. Your hormones go into balance. And when you balance your hormones, everything works properly. Then we have is to make sure those foods are nutrient dense. What are those? Vegetables, protein, and healthy fats. So it's really, really exciting stuff. Now, let's go ahead and talk about, so digestive health and detoxification, the 4 S's of stress, sleep, social, and spiritual health. Make sure all those are in balance, because when you heal those problems, you can heal not one symptom, but then all of them simultaneously. So it's pretty exciting. Thank you guys. We want to know where you guys are listening from. Say hi. Want to make sure you're watching. Yay! Thank you for the heart love. Thank you for the thumbs up. But we're going to go ahead and talk about something that is, we've been talking about deficiencies. And so, yes, diet is the key piece, but sometimes you have deficiencies in vitamin B or D or magnesium, fish oil, probiotics. Those are the main supplements that we take. But what's really important is you need to get those from food sources, but sometimes we were not getting enough from those food sources. So if you wanted to, we talked about all of those different vitamin D, fish oil, probiotics, magnesium. We talked about all those in different Facebook Lives that we did. So go ahead and scroll that. But what's really, really cool, now we're going to talk about vitamin B deficiencies. Because the fact that they even did a study in Harvard School of Public Health, that a fraction of the United States are getting, only a fraction are actually getting the daily recommended B intake. And that we need bees for, like, basically it's really, really important for energy, metabolism. It supports nerve function, liver function, skin, eye health, fetal growth, development during pregnancy. So all of those, and a lot of times if a lot of people are likely to lack B12 if they avoid eating certain types of foods. And those are like what foods, those I'm going to talk about in a little bit more detail, but if you're not getting a lot of green leafy vegetables, if you're not getting some sort of high protein, which is, B vitamins are found in fish and meat and eggs and dairy products, or seeds and legumes. So if you're not getting all of those in your diet, then you're probably not getting enough B complex. So because then B problem intake can actually, the studies where it actually leads to chronic fatigue, anemia, mood disorders, weakness, poor memory, and so much more. So we're going to go ahead and talk about a little bit more about different types of bees. And that's where Abdullah's going to tell us. Because, Abdullah, how many B vitamins are there?
Well, there's 8 B vitamins in total, which include vitamin B1, vitamin B2, vitamin B3, vitamin B5, vitamin B6, vitamin B7, vitamin B8, 12, and folate.
Right, that can also be
called vitamin B9.
Okay, nice. So there's folate, and then the synthetic form is folic acid, but we want to stick with the folate. So they have tons of benefits. Abdullah, what are the benefits of all these B vitamins?
Well, benefits, it helps blood cells and nerves. It may help with fight heart disease, gives us energy and supports our metabolism. And then it aids in development and helps prevent birth defects. It helps maintain healthy brain and nervous system.
Ooh.
It supports skin health, muscular tone, and hair growth.
So that's a lot of stuff that the B vitamins actually do. So it's really important to get, again, those two foods. So now that we talked about the foods, so Abdullah, what about B vitamins? Where is B1 found?
Well, B1 is actually found in nutritional yeast and seaweed like spirulina, selena, sunflower seeds, macadamia nut, black beans, lentils, navy beans, and all those kinds of peas.
And liver. You love liver.
No.
I sneak it into their foods. They don't know. And then what about B2?
And B2 is liver, again, grass-fed beef, seaweed, feta cheese, almonds, mackerel, eggs, sesame seeds, and goat cheese.
Okay, B3?
B3 includes liver, chicken, sunflower seeds, beef, salmon, green peas, turkey, tahini, mushrooms, and sardines.
Ooh, we just had sardines the other day. What about B5?
Well, B5 is meat. It's in meat, organ meats, beans, salmon, veal, certain nuts and seeds like sunflower seeds, avocados, portobello mushrooms, and raw milk and eggs.
Oh, wow. What about vitamin B6?
Vitamin B6 is beans, poultry, turkey, fat fish, grass-fed beef, nutritional yeast, pinto beans, sunflower seeds, chickpeas, and some vegetables and fruit.
Oh, awesome. And then what about B7?
B7 is meat, eggs, liver, whole grain, potatoes, beans and lentils, leafy greens, salmon, avocado, cauliflower, berries, and mushrooms.
And last two, so we have folate. Sorry, B12. Let's do B12 first.
B12 is fish, organ meat like liver, poultry, meat, eggs, dairy products, and natural yeast.
Nutritional yeast. And then folate.
And then folate.
Which is also B9.
Yeah. Folate is asparagus, beans, peas, and lentils, eggs, leafy greens, beets, citrus fruits, Brussels sprouts, papaya, spinach, and broccoli.
So, do you see how, like, this is why I don't give my kids grains, because of the fact that there's very limited nutrition in grains.
Yeah, it's only
you
in
can
one.
Get it, well, yeah, I mean, differently.
Whole grain.
You can get it in all these other different vegetables have so much more, because I realize that they eat their grains, they don't eat their vegetables. And the vegetables in and of themselves have so much nutritional value. I want to make sure that you get their vegetables, protein, and healthy fats at each meal. So, we talked about, I quickly skimmed over the symptoms, because a lot of people that come to me have a lot of these symptoms. Abdullah, can you go through exactly what kind of symptoms somebody will have if they have vitamin B deficiency?
If you have vitamin B deficiency, you'll have fatigue and weakness, depression and anxiety, memory impairment, dry skin, acne or dermatitis, brittle nails and hair loss, poor dental health, including bleeding gums and mouth sores.
Awesome.
Then there's digestive problems like nausea, diarrhea, cramping, shortness of breath, birth defects, and ptosis, such as, and swelling of the tongue, the disease called beriberi.
Yeah, that's weird. Was really
lack of vitamin B.
And then there's a lot of different ones, there's Wernicke's, encephalopathies, and there's so many other different things. But simple chronic conditions, or even if you are chronically stressed, right? Mm-hmm. Or not eating a proper diet, if you're vegan or vegetarian, if you're not absorbing things through your gut flora because of your gut dysbiosis. Then we have is if you're over the age of 50, if you're not eating enough calories, if your caloric intake, if you're smoking or using drugs, sleep deprivation, intense training and exercise. There's so many things like being on oral contraceptive pills, life changes, events that life changes anytime that you have a baby or travel or, move. All of those can cause a lot of deficiencies. So when people come to me, Renee says, thank you. Thank you, guys. Thank you. We want to know where you're talking from. From San Francisco. Ooh, here we're all winter and snow, so it's pretty crazy here. So we talked about where you can find vitamin B, what the foods were, what it's really important for, and what kind of symptoms you may have if you have deficiencies. But now let's go ahead and talk about how I actually do it in clinical practice. Because what I do in clinical practice is I don't put everybody on B vitamins just yet. So the first time when they come in, then we do an entire full-fledged history. And I talk to figure out where their individual's deficiencies may be. Right after that, what I do is I talk to them about improving their, all those foundations of good health, digestive health and detoxification, the 4 S's of stress, sleep, social, and spiritual health. I send them for laboratory tests, and then when they come back to me, I really make sure that we get, B, like homocysteine levels or B12. I get all of these like magnesium and fish oil, magnesium and vitamin D levels, insulin levels. So there's so many levels that I would get if I was able to really determine exactly what I need, what their individual deficiencies may be, and what I need to now address. So what's really, 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 really awesome is that just by these simple laboratory tests, you can figure out a lot. And it's just these simple tests. And that it's mostly covered by your insurance. So what I do is I specifically when your B vitamin, so your B12 level is less than 500. I usually bump you up to about, if it's less than 500, then I give you 1,000 mcg per day for about 3 weeks, and then I'll go down to like 500. If you have high homocysteine levels, then that's another reason that I would put you on a B complex. And that B complex, if you have high homocysteine levels higher than if you have it like more than 8, then I will also put you on B complex, and that makes sure that you have a B complex of 500 B12 mcg per day, folate by 500 milligram mcg per day, and then also the folate, the B6, and that's 50 milligrams per day. So make sure that the B complex has those things, because when you have those things, then it really helps to optimize your health and healing from the inside out. So here, let's go ahead and answer some questions. Hi, Assalam, Ashifa, Renee. Thank you, Renee. Please let me know. I'm here for you guys. If you guys have any questions, please like and share this video so then we can spread the message of hope and healing to those that need it, that there is, you don't have to be suffering from your chronic conditions. There is hope. Parveen is from California. Carol, would you like to tell us something? If someone is depleted, I heard eating carbs can deplete. So yes, so we talked about the different things. Abdullah can tell us exactly, the risk factors again for being when you're B deficient. So what are those again, Abdullah?
Well, those again like being chronically stressed, eating a poor quality diet, being a vegan or a vegetarian, poor absorption of nutrients due to impaired gut health, being over the age of 50 or elderly.
If you're just like calorie restriction, smoking, or even using drugs. So those are the specific vegetarian, vegan, is where I really put people on my B complexes, especially if you have anxiety. And then remember, if you have specific individual deficiencies, or if you have, I put anybody with anxiety and depression, I'll put them on a B complex. So there's really a lot of different instances that I'll put them on a B complex. But for me specifically, I will keep it, I only put people on limited supplements as possible. I don't give them a lot of supplements. So, so if you guys have any other questions for us, I'm here for you. You can go ahead and listen in. Again, I'm Dr. Madiha Saeed, a board-certified integrative holistic family physician. And so now there were a lot of questions that I got in my email, and I'm going to flip that over right now. So give me a second. I'm going to find these. I had so many questions that people were asking me, and I was going to go ahead and answer those. So here we have one. Okay, so here's a patient who wanted some information in regards to her 12-year-old daughter who has learning disability, and she has audio processing disorder, lack of focus and attention, and she wanted to know if there was any improvement and anything that you can do holistically. Yes. Actually, whenever somebody, remember I work on gut health a lot in auditory, anytime they have processing disorders or sensory disorders, I really give them their, work on their foundations of good health. And then once we lower the overall inflammation, we'll check out their deficiencies, and then you can really heal these chronic conditions. So that's another. And then some people ask me about asthma, same thing with asthma, same thing with allergies. So no matter what you're dealing with, this can really help. So I hope that is, I know I have so many more questions coming up. You guys, we have to run. I have to go pick up, my kids. And they're upstairs doing a detox bath. I can hear them from here, me and him. We stuck them in the Epsom salt baths, right? So if you guys have any questions, please feel free to contact me and leave messages here. Please like and share this video. I would love to educate and empower anybody to help heal from the inside out, because you have this. You can do anything you put your mind to, and on top of that, you can heal your bodies from the inside out. It does take a little bit more energy than just giving somebody a pill, but you got this, and I'm here for you. So we'll see you guys later. Bye.
Bye.